Hi, Melissa. How are you today?
Good, how are you?
Good. How's Liam doing?
He's good, but he's having some trouble still with his R's, and then he also talks very loudly still.
Okay. Well, I'm glad you came in, and hopefully we can provide services that can help him with those areas. So actually, we're going to talk about his goals today and kind of the different treatment approaches that we're going to use in the next couple weeks. So his long-term goal is going to be being able to recognize when he's speaking too loudly and correct that by himself, and then also improving his production of the R sound um, throughout speech. And his short-term goals, like how we're going to break this down into more manageable chunks in therapy, we're going to make sure that Liam produces R by itself, like just the with 95% accuracy. Then we're going to have Liam produce R in the middle of words and also at the end of words with 85% accuracy. And then also making sure that the client is able to identify when he's speaking too loudly in 9 out of 10 common phrases. And these could be common phrases that he uses in soccer. We're going to try to relate them to. And then that he will be able to self-correct when he's speaking too loudly. In 9 out of 10 phrases. And research does show, according to Hooper in 2004, that when you're able to identify the areas when you're speaking too loudly, then you're able to correct them. So identification is key. And then also, according to Blash, Parsons, and Humphreys in 1981, there have been studies that have shown that being able to use minimal pairs is really key in therapy. So minimal pairs are like, for example, two words that sound the same but differ in one place. For example, whack and rack. The ack is similar, but the r and the w is different. And also we're going to teach Liam how to use his articulators, which are kind of the parts of his mouth, and how to demonstrate that so he understands. So throughout treatment, once again, for voice, we're going to have recordings of his voice as he reads common phrases, and then he's going to listen to the recording, and he will be asked whether his voice is too loud or too soft, and then I will be asking him that. And then also, he will be able to have the chance to self-correct in appropriate volume. For his articulation portion of therapy, it's going to be using a tongue depressor and using tactile cues and visual cues and modeling and demonstration to show him how to produce an R. That's definitely part of it. And then even using a mirror too is another tool. And then moving on to the minimal pairs part, like we talked about, using two sets of words like whack and rack, and being able to produce the R is definitely the goal for that. So that's kind of our treatment. Do you have any questions going forward?
No, that sounds perfect.
Great. I'm looking forward to therapy with Liam.
Yeah, thank you.
You're welcome.